Good evening. It's 6 o'clock. Thank you for joining us. My name is Eric Elliott. I'm a hunter education coordinator with the California Department of Fish and Wildlife, and we're delighted that you're with us tonight. So with fall just about around the corner, so many of us are just chomping at the bit to get out and hunt. And dove season's going to be opening up really soon. So we wanted to take just a second to do a safety briefing. But the whole idea behind this is just preventing accidents. So I want to take a second to remind folks of the value of hunter education. And the fact is that hunter education indeed works. And the proof is in the stats. Prior to hunter education being a requirement in 1953, 43 people were involved in hunting accidents, of which 6 were fatal. Get this, after the first year of the hunter education requirement, more than 17,000 students were trained up in that very first year. Of that group, only 3 were known to have been involved in a hunting accident. And guess what? None of which of those were fatal. So let's just take a second and let's go back and let's remember the fundamentals of hunter education. Let's go through the 10 commandments of hunter safety with the whole idea of no one can be too experienced for this. No one can let their guard down. It doesn't matter if you've been in law enforcement for years or you're a brand new hunter. We all need to follow these fundamentals. So number 1, watch the muzzle. Treat every firearm with the respect due a loaded gun. Be sure of the target and what is in front of it and beyond it. Keep your finger outside the trigger guard until ready to shoot. Check your barrel. Check your ammunition. Unload your firearm when it's not in use. Point a firearm only at something you intend to shoot. Don't run, jump, or climb with a loaded firearm. Store firearms and ammo separately and safely. Avoid alcoholic beverages before and during shooting. And lastly, while it's not a legal requirement, it's a recommendation. Wear blaze orange. With that being said, I want to thank all the hunter education instructors again. These folks are committed to teaching the hunting fundamentals. And thank you for your willingness to pass on our hunting tradition. So for tonight's webinar, there are going to be topics that we do webinars and hunting clinics on that are going to hopefully improve your hunting skill set. And that's awesome. We have a whole long list of hunting webinars and clinics to come. But this webinar may just give you a skill set that can change and actually save a life. Our instructor tonight is Mike Pettingill. He's a certified hunter education instructor for the California Department of Fish and Wildlife. He's a certified firearms instructor with the California Department of Justice. He served the U.S. Army as a paratrooper and a medic. Mike, thank you so much for being with us tonight. The floor is yours.
Thanks, Eric. All right, everybody, welcome. I just wanted to tell you all that is very excited to have you here. I know this isn't the hunting topic we all wanted, but this is the one that we all need. This is something that really comes from a really evolving history of first aid care. So I'll put some context to this. So I'm 54. And I was a medic in the Army, started in the early 90s. And I've been first aid and CPR trained since my late teens. And I distinctly recall, and some of you may recall this as well, that when it came to topics like tourniquets, the training went something like this. Apply the tourniquet, and then every 5 minutes for 30 seconds, loosen the tourniquet, allow the blood to get to the dying tissue. Some of you may remember that. Then it evolved. And I'm paraphrasing. This is Mike's explanation. It evolved into, nope, don't do tourniquets. None of us are smart enough to do that stuff, right? Leave it for the pros. And you may remember before that, right? In the days where we were encouraged to maybe do a little bit of work, they would have us mark the time that we applied the tourniquet, so that the really smart folks, the EMS folks, the medics, the doctors, they could know how much damage we had done, right? So they told civilians and average people just to walk away from that type of thing. We don't have the skill set needed to be involved in addressing the bleeding. So with some gross generalizations, what occurred is during Afghanistan and Gulf War II, all of our Marines and our soldiers, they all got tourniquets, and they were issued tourniquets. They were told to shove these in their cargo pockets, and your tourniquet was your tourniquet. And if you needed to help somebody else, you used their tourniquet. You kept your tourniquet. And from that, the people who research these things to decide what's the best course of practice for average citizens like us did a big survey and discovered, with 20,000 data points, that when the soldiers and the Marines applied a tourniquet onto an individual and they left it on for 10 or 12 hours in the worst case scenarios. Imagine an awful firefight and your buddy gets hurt and you put a tourniquet on and there's just no way to do a medical evac. And those tourniquets would remain on for 10, 12 hours. And guess what they found? That even after 10 or 12 hours, that data that we thought we knew was wrong. That there was no negative reaction with lack of blood flow to the dying tissue. So no more did they say, yeah, loosen the tourniquet a little bit, allow a little bit of blood to go in. No, that's completely changed. The answer now is turn that tourniquet, and we'll talk more about it soon, but turn that tourniquet, tighten it up, don't touch it. And they even say now, and we'll talk about this again a little bit in depth, these little time stamps that are still on here, if you have anything to do taking the 5 seconds to write the time you applied this tourniquet, if you have anything to do, triage another patient, make this patient more comfortable, give them water, anything, call for EMS, whatever, don't bother writing the time on. So that's even changed completely, to the point where the official training is, yeah, if you've got nothing else to do, write the time on, right? So it has completely evolved in my short lifetime, where we've gone from, yeah, most of us just aren't smart enough to deal with this, to now this is the answer. So this is the answer. The Stop the Bleed program, which is what we're going to go through. My wife is a nurse. She really knows her skills. She's been a nurse in pediatric oncology and dialysis, and she was a nurse in the jungle for 10 years. And she's the one you want teaching this class, but she was busy. So you guys get me. So the reality is I'm trained by the best, which is my wife. And I'm certified as a Stop the Bleed instructor. I'm a certified instructor for the American Red Cross for first aid, CPR, AED, adult, child, and infant. And then, like Eric said, I spent a few years as an Army medic as well. So I've got a pretty tolerable background for this. My wife and I are full-time instructors. I'm the owner and primary instructor for our business, which is Personal Protection Academy. And amongst other things, we teach tactical medicine. We teach Stop the Bleed. We teach first aid, CPR, AED. So I have a lot of experience teaching and certifications in this and applying this. The Stop the Bleed program has really kind of exploded in recent years. This has kind of become the standard program that really everybody is looking for. I'm a primarily a firearms instructor, and I can tell you that when you're an instructor and you go to a range, the owners of that range now want two things. They want to make sure you're an NRA range safety officer, and they want to make sure that you're Stop the Bleed certified. And this is the trauma that is the most preventable, and it matters the most, to the point where when I give my range safety briefings, I'll tell my students, you're the caller. If something happens, you pick up the phone, you call 911, and what you tell them is, there's been a training accident on this range. You can't say shooting incident, because that means the police have to come in. They've got to clear the field, and that's the valuable time that we're losing EMS. And so everything is now about getting the patient to the point where they can sustain life and then get EMS there as quickly as possible. You call EMS, you address the bleeding, and then let the smart people take over from there. So bleeding is the #1 cause of preventable death after injury. And what we see is that depending on your cardiovascular system, you can bleed out very rapidly. You can absolutely bleed out in a minute, depending on your VO2 max, your cardiopulmonary system. My wife I'm an ex-marathon runner, and I've got a great VO2 max. I've got a great resting heart rate and a great slow breathing rate. And my wife, the nurse, the dark humor in the house, she always says, yeah, but just think how fast you're going to bleed out when you get cut. I'm like, well, that's what you're here for. So that's what you guys are here for, is to make sure that all those healthy people with strong hearts can survive. So where can you use this training? You can use it literally anywhere. Remember, when it comes to Good Samaritan laws, you are covered for anything that you are trained for. So if I decided I was going to do a tracheotomy, or I decided I was going to deliver a baby, I might have issues. I've not been trained in those areas, but you guys are now going to be trained in 3 very important areas by the end of this webinar: packing, pressure, and tourniquet application. And we'll go through all those. But these skills are gonna help you no matter where you are. Our goals are that we want to identify and recognize life-threatening bleeding. When you see bleeding, you jump into action. And then number 2, most important, is you got to stop the bleeding. Pressure, packing, tourniquets, and that's what we're looking for. So your safety is a priority. If you come across a downed individual or an injury scene, you have to assess the situation. You cannot enter into a situation until you've determined that everything is okay. A bad guy, a dog fight, in a case of hunting, has the mountain lion left the scene? Has the bear left the scene? Don't run in to save the guy if the mountain lion's still there, right? Because think about it this way: if there's one person to save and you've just created 2 people to save, you've just doubled the work of our emergency care individual. So you've got to remain safe. For those of you who have that heart, like you really want to take care of people, think of it this way: you're taking care of the EMS folks, because if you double the number of victims by adding yourself to the list, you just made it a more difficult scene. So stop, move safely. If you can, take the victim with you. Move out of the way of danger. Make sure that you're covered with safety. If you get ideally, if you create an individual first aid kit. Make sure you've got proper gloves inside, and take the time to glove up if you can. In my hunting pack, we have gloves for several reasons: for processing animals and for treating wounds to myself and wounds to others. But glove up. Make sure that you are providing a barrier for yourself, and you want to make sure that you're using smart hygiene when it comes to protecting yourself and protecting those around you. So the things we're looking for are the ABCs of bleeding control. Number one, alert 911. That's the first thing you do. It's going to take you a couple seconds. If you've got your cell phone, dial 911, put the phone down, start treating the individual, but you're communicating with 911. They'll talk you through what you're doing as well. They're going to be a great resource for you. A lot of us are in backcountry, and maybe we don't have access. Consider sat phones. If you've been around hunting a while, satellite phones are not as expensive as they used to be. Also know that some of your newer phones will actually default when you lose your cell signal. They will pick up satellite signal. So know what your phone can do. If not, consider some sort of a mechanism that you can stay in contact with EMS when you're in need. So alert EMS, alert 911. Number two, identify the bleeding, and C, compress. So A, alert, B, bleeding, C, compress. So again, contact 911. If you have another individual with you, you've left your sat phone in the car, or there's cell signal a mile away, then you want to, if you're taking charge of the scene, you want to identify to other individuals. You go radio for help, call 911, and return when you're done. So do we want to take the time to alert EMS, to alert 911, and take that valuable couple of seconds away from treating a patient? Yeah, unless you're an EMS provider and you've got that big boy, big girl med kit with you already and you know what you're doing, let's get the people who really have the skills in motion and get them moving towards us. Okay. Understand your location, know where you are, GPS coordinates if you're in backcountry, and follow the instructions of the 911 operator. They're absolutely going to be trained, and they're going to guide you if you're nervous, if you're not trained sufficiently. Now we're looking for B, the bleeding. So you're looking to identify the bleeding. Find the source of bleeding. Look for continuous bleeding, large volumes of bleeding, pooling of blood. Understand that there's going to be multiple sites where the individual may be bleeding from. If you have a shotgun wound, you have multiple entry wounds. If you have an animal attack, you may have multiple entry wounds. You're probably going to need to remove clothing, and you're going to need to understand that the clothing is going to actually mask the bleeding. And so remove the clothing, clear it out, and as you're removing the clothing, you may see additional areas where the individuals is from where they're bleeding. You're going to identify everything. You're going to search the individual. You're looking at the arms and legs, the neck, the armpit, the groin, and the body, the torso. Now let's get into the concept of pressure, what it is you're doing. Again, remember, it's the three things that we're talking about. We're talking about pressure, packing, and tourniquets. So let's move into what you can do. So pressure, applying direct pressure to the wound, focus on the location of the bleeding. A lot of you may remember, if you've taken CPR, and you're going to look at the palm of your hand is where you're placing the for CPR on the sternum, right? And you're going to take your support hand and you're going to pull your knuckles back. This is the same hand maneuver that you're using for applying pressure. And where are you applying pressure? You're applying pressure onto the point of bleeding, and you're putting as much body pressure into this as possible. Having worked with my wife in a couple of trauma instances, she's got the brains. I always sit there and I do the muscle stuff. And so we had one case where someone was bleeding out, and we had our gear, but it was far away. And so we had to send someone to get the gear. And my job was to put my entire weight and body, my strength and all my weight on this individual, because if I took anything off, the bleeding would continue. And I just had to sit there over and over and over again and just keeping that pressure down to make sure that none of the blood was, no additional blood was escaping, until my wife was able to apply a tourniquet, and then my hands were free from that position. So let me take a second and let's do this. Let's see how high tech we can get here. So stop the sharing, and then we'll get my picture a little bit larger. Okay, so this is how high tech Zoom can be, you guys. Take a stool upon a stool. All right, so what you're looking to do, if this is our incision point right here, I'm literally going to take my hand, I'm going to put it right on the incision point. You're going to get blood, you're going to contaminate. What's better, to have an infection or have someone bleed out, right? Hand goes right on, pulling my knuckles back. I'm putting all my weight on, and I'm trying to get as much muscle, as much weight as I can behind, because what I want to do is I want to pinch those blood vessels and those arteries down. I am looking to aggressively put this down. Now, this stool is an awful example of where you want to apply. If at all possible, I want to get the individual to the ground. And the primary reason is, number one, you don't want them to fall. But number two, when it comes to pressure, you want to be able to put your whole body on top of this wound, and make sure that that you're closing off that additional bleeding. So let's just take a quick look at what we talked about. We're taking my dirty hands. I've been out hunting. I've got dirt under my nails, and I've been creating a bacteria, and I'm putting all sorts of awful bacteria into this person's body, right? And again, what is worse? What's worse to happen is for you to get a little bit of infection in there, or for you to stop the bleeding. Right now, their biggest concern is bleeding. If a person can bleed out inside of a minute, let's worry about that right now. We'll address infection later, okay? So let's talk about our second C, which is compression. And so ideally, what I carry in my backpack for hunting, what I carry at the shooting range, what I carry in my individual first aid kit, is compressed gauze. And the reason why we like compressed gauze is because you're getting a whole lot of material in a very small area. But if you're looking at something like this, and ideally you're looking for a lot of material, ideally you're looking for something that's sanitary. You're looking for something that is that's free of bacteria. But if it comes down to it, pull off your sweaty shirt and use that. Again, we're looking to stop the bleeding because we're looking for the first emergency. But what you're doing, so I'm going to take my fist, and right here is going to be my my incision point. Let's call it an entry wound from a rifle round. And you're literally going to be taking your gauze and you're shoving your finger in there as deep as you can get it. And you continue to pack and to pack and to pack and to pack until you literally can get nothing else in there. So what we're trying to do with all of this gauze is we're trying to cut off all of the arteries and all of the capillaries and all of the veins that are bleeding freely. And we're trying to provide them with assistance. So if it's deep, pack it deep. Get your hand down in there. Doesn't sound like a lot of fun, but it's super important. I'll give you one really good example. Again, talk to you about my wife, the rock star. My wife and I were at a field training exercise, and the instructor took a 6-inch bladed knife, and he had a pork shoulder covered with flies and nastiness. It had been sitting out in the Oklahoma sun for about an hour and a half. He took the blade, he plunged the blade into the pork shoulder and told all the students, okay, somebody save the patient. And all the guys stood there. My wife, the only woman in the class, just said, get out of the way, get out of the way. And she took as much gauze as she could, and she had her whole hand in there and packing as much as she could into that. And then at the end, the instructor got all the questions like, well, is this lady, I mean, putting her whole hand in there, is that what, isn't she ripping more? No, the body's gonna stretch. Well, isn't she infecting? Sure, probably, and saving the guy's life at the same time, right? And so pack, and then once you get it all packed, then you're adding more pressure, and you're putting pressure on, okay? So, the pressure, I mean, remember pressing your palms on and then packing the wound. Okay, you're not going to take the gauze and just simply put the gauze over top. You're putting it in there, and you're going as deep as you can. Okay, so where can you pack? You can pack anywhere where there's bleeding. You can pack the neck. You can pack the armpits and the groin. Anywhere in the body, anywhere you've got bleeding, you can pack, okay? So let's talk about tourniquets. The rule of thumb, well, let's talk a little bit about, let's give you the rule of thumb on the tourniquets. So let's say this is my entry wound. I've got an arrow through my arm, and I'm gonna go right here. My general rule is 2 inches below towards the heart, obviously, right? 2 inches below the bleeding site, but not on an elbow, not on a knee. I know this sounds funny, but also not on a neck. No matter how much you want to, it doesn't go on the neck, right? It's for limbs. Tourniquets are for limbs, okay? Now, here's something that's interesting. This isn't a part of this curriculum, and it's not a part of the American Red Cross curriculum. But if you have military personnel, I've got a lot of military medic friends, and they have told me that what the military is starting to do, and which means in about 4 or 5 years, it's gonna bleed out to us, which is they no longer look at the point of entry and 2 inches below. They look at high and tight. Just go up towards the groin or up towards the armpit, because obviously the blood's got to travel to that location. So if this is your entry point, 2 inches is the official training for stop the bleed, but the military is starting to say, just come up to the armpit. It's fine. Now, what else can you do? You can apply multiple tourniquets. If this is my entry point, I can put a tourniquet here. I can't put one on the elbow, but then I can go here. And if I want to put a third, I can put one here. And here's how you apply the tourniquet. You want to put that thing on, right? Let's go ahead and do this. You want to put that thing on, and you want it tight. So right off the bat, before I've even turned the windlass, I've gotten it tight. And then you want to crank this windlass until it stops the blood, is your bottom line, right? You're just cranking and cranking and cranking that windlass. How tight do you crank it? In my in-person classes, when I'm teaching this, I make student A put the tourniquet on to student B. And I tell student A, you pass only when student B cries out in pain. That's how tight we want this windlass to be. We've had lots of cases where in Afghanistan and Iraq, the soldiers have said that the person they put the tourniquet on reported that the tourniquet hurt far worse than the bullet wound did. And so you are cranking this, and you will find what's going to happen is you're going to feel like, oh, I don't want to hurt the patient. I don't want to hurt the patient. I don't want to hurt the patient. Crank it until the blood stops. That's what you're looking for. And what you'll typically find is on a lot of these, you're going to crank it until you can bring it around and clip it right into there. Then you take the Velcro and you put it over, and that seals it into place. Now, here's, while I've got this up here, here's a really good indicator. The windlass that you see right here, this is a cheap plastic windlass. People are selling these on Amazon for like $6, $7, $8. Buy one as a training tool. Okay. You're looking for a metal windlass, not a plastic one, because you'll find, and we did this as an experiment. My wife put this on my thigh, not this one, put one of these on my thigh and cranked it and cranked it and cranked it. And the windlass broke before I could complain and before my wife could exhaust her strength. So don't waste your money on a plastic windlass. Okay. So go ahead and spend a couple bucks. You're going to look at about 30 to 35 bucks. We'll talk more specifically here in a second about these tourniquets. But what you're doing with the tourniquets, again, I keep my everyday carry consists of a knife and a tourniquet at a minimum. I don't walk to the mailbox without a knife and a tourniquet. So we buy these and we put them in several in each car, kitchen, garage, wherever there's anything sharp, hunting backpack, range bag, med kits. Okay. So tourniquet is the answer now. Don't remove the tourniquet. Keep the tourniquet on. Don't loosen the tourniquet to allow bleeding, to blood to get to dying tissue areas, but tighten it down, crank it down. Don't remove that thing. Okay. You can apply them to yourself. We have in our tactical training, kind of one of the funnest things that the students will do in the 6-hour class is we give them a dummy pistol. And we say, okay, you're in the movie theater, you've got a tourniquet and a pistol. So address the situation, and they stand up and they say, bang, bang, bang. Oh, you've been hit. Take your tourniquet out, apply the tourniquet to your leg. Tourniquet, 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 right? Applying it, applying it. Oh, more bad guys. Bang, bang, bang. Apply the tourniquet. More tourniquet, more tourniquet. Oh, more bad guys. Bang, bang, bang. So going through the idea of applying the tourniquet in a stressful situation, applying it to yourself. And that's the one great thing about a tourniquet is you can do it. I'm right-handed. You can do it left-handed. I can put it on myself. I can put it on my leg. But you want to apply it. You can apply it over clothing. You don't, as long as you know where the bleeding is coming from, you can apply it. It's no big deal. Again, you can go 2 or 3 tourniquets as needed. But like it says right there, it's going to hurt, man. These tourniquets are going to hurt. So let's go over a couple of the tourniquets I have here. So this is kind of your mainline tourniquet, your cat tourniquet. This is what you'll find most often. So when we build, this is a med kit, individual first aid kit that we build. And in this kit, we put 2 tourniquets. We put chest seals for entry and exit wounds on the lungs. And we put remember the white chemical that they would sprinkle on soldiers in World War II movies, the quick clot, that's now in sponges. And so we put these in the sponges. So if there was anything that I would tell you is get a couple tourniquets, get a couple chest seals, and get some quick clot. Okay. Make sure you have some compression gauze so you can do some packing as well. So a kit like this would be a good kit to just have in your depending on if you're going just day camping, day hiking for your hunting. If you're going deeper into the woods, you want something more important. It's gonna be more substantial. But this is your basic cat tourniquet. This is basically what you're looking for, right? This is kind of a step up. This is called a SOF, S-O-F-F. And this one has a cranking system, like tie down straps on the back of your load in your pickup truck, where you crank it. That's what this one has. So it's the same process, but it slips into place, right? Comes apart so you can put it around a big thigh, connect it, and then you literally ratchet it down. And then again, you can see it's got the kind of a quality metal windlass is what you're looking for. Now, kind of at the other end, this isn't bad, okay? But this is called a SWAT T, and it's elastic material, right? It has some instructions on it too, which is pretty nice to give you some basics. But you can use this as kind of a really good all-purpose as pressure dressing, as a tourniquet, or even as a sling to put your arm through if you've got a busted arm. So something like this is a good all-purpose item. If I could have 2 of these in place of 1 of these, I would get these. But this is not a bad option to have as far as a good tourniquet. Let's talk about some of the things that I hear in class a lot. Are people talk about alternatives to tourniquets. People want to talk about, well, a broomstick and your belt, or a t-shirt and a stick. Not amazing options. Again, if I leave the house, one of these go in my, I'd stand up right now. I'm wearing cargo shorts right now, right? I'm that 54-year-old guy who still wears cargo shorts. One of these goes in my cargo pocket wherever I go. Maybe for me, maybe for someone else. I got a belt on too. If I need a belt as a secondary tourniquet, that's great. But I would rather have one of these. I'd rather spend $35 or $30, throw one of these in, and know that I can put a tourniquet on myself, and I can have that as opposed to a belt. Is a belt or a t-shirt and a stick a better option than bleeding out? Yep, for sure. But nothing's going to beat a tourniquet, and you can keep it nice and compact. These are some of the recommended and approved tourniquets that you're going to see. They're now actually, since the creation of this, they're up to the Cat 8, the Gen 8 of the Cat tourniquets. And that's actually the Cat 8 now actually has a plastic windlass, but it's not one of those cheap ones you get on Amazon. It is a real hardcore composite. And so when they came out with the plastic windlass on the Gen 8 Cat 8 tourniquets, people said, no, we can't have those because they have plastic windlasses. They're like, no, they're made of wonder material. So these are some of the good ones. Take a good screenshot of this, and these are the ones you're looking for. These are the ones you're going to find. They're entry level, $35, but what's your life's worth, right? You can buy 5 of these cheap ones off of Amazon, or one really good one, and you'll go through these in a heartbeat. So use these for training. Go ahead and buy one of these for training. So some pneumatic limb tourniquets are also decent options. They take a little bit more training. These are things that you're going to find. My wife carries one of the Delphi EMTs. I have no clue how it works, so I know she's got other good ones in there, but people who are smarter than me put those in there. So in all but the most extreme circumstances, when it comes to stopping the bleed, if you've done CPR, you know that what they used to train us was kids are treated differently than adults. And when it comes to stopping the bleed, there really isn't. You might find that in very small children that a tourniquet might be too small. A typical tourniquet might be this one that ratchets, right? The one that I told you, the soft, that will go way down. It'll go down to the smallest of arms. Okay, and so you can take that all the way down to a baby's thigh or a baby's bicep. You can do wound packing, you can do pressure, you can do tourniquets in the right format on children and infants. So when you have, here's some pretty frequent questions. When you have an impaled object, an arrow would be something that we might come across most frequently. Do not take it out. Okay, do not pull it out. And here's there's concern about, when I ask this in class, everyone says, well, yeah, you're going to cause more damage. That's true, but you also might cause more bleeding. And what I'm saying is that if you've got a hole that was created by an arrow and the arrow's in there, that arrow might be slowing down or stopping the bleeding because it's severed arteries or veins, but it's also standing in the way. You pull it out, now those arteries and veins that are in there now have free flow. So don't pull out impaled items. We talked about improvised tourniquets. A lot better than standing there watching someone bleed, but invest a little bit of money in having a tourniquet with you. What about the active loss of an arm or a leg? If you see someone's arm blown off or someone's leg blown off, absolutely, tourniquet is what you're looking for. And then the inverse aspect of it, going back to that old training, does leaving a tourniquet on too long, is there concern for loss of limb? The studies off of our soldiers in our boys and girls in Afghanistan and Iraq has said it's a non-issue. Just go forward with it. Pain, yep, going to be lots of it. You're going to have lots of it when you're packing. You're going to have lots of it when you're adding pressure, and lots of it when you're in a tourniquet. And you just need to have to help that patient get over that. Tell them that this is what they need right now to save their lives, and this is what you need to help them to move forward. So let me go into summary, and then we'll open it up and make sure that we cover any questions that anybody has. So if you've got some questions right now, go ahead and type them in, and then I'll talk to you about the summary real quick, and then I'll talk to you about Stop the Bleed certification, because this training can go towards, if you're live, can go towards Stop the Bleed certification. If you're watching this on YouTube, sorry, no go. So as a reminder, ABC, alert 911, let them know, get the good, well-trained, smart people there as fast as possible. Number 2, B, identify the bleeding. Open up clothing, rip off clothing. Make sure if you see pulled blood, if you see blood-soaked clothing, it may be multiple entry wounds, multiple bleeders. You need to identify what the worst one is, okay? And one of the worst things, not one of the worst things can happen, but a bad thing that can happen is if you identify that I've got a bleeder right here, but you didn't pull my sleeve up and discover that I've got one up here too, then you're trying to stop the bleeding here, but this is the one that's killing me, right? And so the big thing is if you identify that there's a bleeder here and there's a bleeder here, then you apply the tourniquet up here. And if you apply it down here and I'm still bleeding out here, you're not doing me much good. And stay with the patient and be with them while you're waiting for EMS and the pros to arrive. So for more information on Stop the Bleed, that's where you can go, stopthebleed.org. And you can get some of the training that they have there. This training class that you've just gone through is the same exact training that you would go through in person, except for the practicals. And that's where this is a differentiation. So let me explain to you what this class is good for, other than obviously the great information you just put in your head that you take out onto the field, that you pass on to students. You've just completed part of the certification if you're live. And what is required is that I can teach you this live and in person over video. You still have to do the practicals. You still have to pack the wound, right? Pack the fake wound. You still have to apply pressure. I have to see that you're doing that right. And you still have to apply a tourniquet appropriately. So what you can do is Stop the Bleed has said that as long as you have gone through the class like you just did, that if you can go to a Stop the Bleed instructor and you can get signed off on the 3 practicals, packing the wound, pressure on the wound, and tourniquet, then you can receive a Stop the Bleed certification. I'm in Murrieta, California. My email address is right there below my name. If I can help you with this, just let me know. I will provide you with I'll make a special appointment for free to make sure that you get signed off on the practicals, and I will personally provide you with a certificate. If you want me to communicate with if you're in Shasta or Redding or Yuba City or Sacramento or San Francisco or someplace else, and you don't want to travel to Murrieta, not a problem. Have your Stop the Bleed instructor near you communicate with me. I'll let them know that you signed off. When we're done with this, I have access to your name and phone number and email address. I know that you attended the class. Okay, I can attest to the fact that you're ready for the sign off, and all you need to do is spend about 10 minutes, maybe 15 minutes, packing, pressure, and tourniquets, and you're all set. But this is your first step towards your Stop the Bleed certification. So let me shut up and see if anybody has any questions. Anybody wants to understand a little bit more.
Mike, I'm not seeing any questions on the Q&A, but I've got one for you, brother.
Yes, sir.
Yes. So I'm going to put you on the spot.
Talk to me.
Let's get to the nitty gritty. Have you or any of your colleagues ever actually done this and possibly stopped the bleed and saved a life? Do you know of anybody that's done this?
Sure, for sure. So my wife's done it about 1,000 times. My wife, praise God that every time I've come across a situation like this, my wife's been there with me to tell me what to do. But yeah, when my wife has always walked around with all the high-end med kit stuff. She literally has an AED in her car, and she's the lady you want to get hurt next to, right? And with her assistance, I've when it's come to stopping bleeding, I've been able to participate in 3 people's big bleeding concerns and save 2 of them. So one guy was beyond.
That's awesome. So one of the questions I'm seeing now is, can you give medication to a bleeder?
So there's a lot of controversy about you and medication, because remember what I said is you can't do anything beyond your scope, right? And unless you guys are pharmacists or EMTs or docs or nurses, you can't give meds. If someone is there that needs their prescribed meds, I'm having a heart issue, I need my medicine, or if they've got something, they know what's going on, you can hand them their medicine and they can take it. And then you have, beyond that, Good Samaritan doesn't cover medication with you unless you're trained in that area.
Makes sense. Okay. And how about, what if you have an impaled object in someone's eye?
Don't pull it out. Don't remove anything. What you want to do is you want to secure that in place. It can be an impediment to stopping bleeding, right? But you want to do everything you can without removing the object. We could cause more damage. Us untrained people can cause more damage. And remember that removing the object may open up some of those blood vessels and arteries that are perforated and cause more bleeding.
Excellent. And how about if the wound is too high and you can't apply a tourniquet?
Then you're looking at pressure and packing. Okay, so let's say we're right here, right? Let me get there. I'm inside my armpit, right? And I get a gunshot wound or an arrow wound inside my armpit, and you can't apply a tourniquet to that, you can still pack that, and you can still apply pressure on that.
Excellent. And then packing a suction wound, same kind of principle, Mike?
So I think I think what the person's referring to is not a suction wound, but it's called a sucking wound.
Okay.
And that's what you're going to get when typically, and this is what it looks like, would be a through and through arrow or rifle round or a small arms round that's going to go through the lung and back out the other side. So the key to that is in our everyday first aid kits that we sell, in our first aid kits that we carry, we have chest seals, and it's super simple. Chest seal on the entry wound, chest seal on the exit wound, without getting into too much detail. If you have oxygen coming in through the chest or the back, it's going to prevent the person from breathing properly. You cover that up, and you can allow them to breathe. If you don't have, this is really cool, my wife showed me a bunch of these. If you don't have chest seals, a plastic wrapper and some duct tape are going to work perfect. Put that over the wound, duct tape it in place, and you're set for life.
Awesome. And then how about what do you think is the most common injury seen while hunting? I think let's specify like common bleeding injury.
So you talked to me about that, Eric. Statistic off of some of the statistics we cited, and you got more knowledge about that. What are some things that you've seen that you've heard of on a statistical basis? And I'll give some hypotheticals, but what have you, numerically, what have you seen? What have you heard about?
I think quite a few. A lot of it's just peppering. There's with shotgun, like during dove season, and then there's more extensive injuries, with a long gun or a handgun. And then, just like as you preface this whole course, I mean, going to and from hunting, you just never know when you can come across this, whether it's an accident. I've seen that even off duty, just stopping in an accident and seeing just traumatic injury and a lot of blood. So yeah, for hunting, I would say probably a firearm injury, sometimes archery stuff, even with the use of sharp broadheads. Sometimes just people accidentally cutting a finger or something like that.
Here's a couple, another one to think about. That's probably a lot of us hiking and falling and having compound fractures, or impaling ourselves onto down branches, or impaling ourselves on our own equipment. But a compound fracture, you could actually get some pretty substantial bleeding if you've got an offset bone break, and that perforates and causes bleeding. You could have that, would be something pretty substantial. Animal bites would be another one.
Yeah. So there's a question that talks about
all of these all of those could theoretically be addressed by the Stop the Bleed here.
Yeah. The question about canine specific kits to stop bleeding. Have you ever seen that, Mike?
Yeah, they exist. There's no chemical reason why you couldn't use this on your pup, right? As a guy who's all into rescuing dogs and pit bulls specifically, I love the idea. My wife has indeed applied a tourniquet to one of our dogs that got in a fight with another dog and got a bleeder, man. And that dog would not have lasted. If we last a minute, the dog wouldn't have lasted 30 seconds if my wife hadn't have taken her t-shirt off, tied it around the dog, pulled it tight, twisted it, and the dog's trying to fight her back, and held it in place while she was driving. Yeah, for sure. But there's nothing chemical wise or biologically that says that you couldn't apply any of this to your pets as well.
Yeah. So this question talks about why wouldn't you apply a tourniquet and then pack?
If you can get away with packing, if you can stop the bleed with packing, think of it as a not a hierarchy, but a step process, right? Start packing first. If that's enough, great. If that's not enough, keep the packing in place and add pressure. If that's not enough, okay, move on, tourniquet. Think of it as a step process.
Awesome. And I've never heard of an Israeli bandage. What is that, and do you like them?
I got like 10 of them right there. I almost brought some in, but I thought it wasn't relevant to the class. Awesome. H bandages or Israeli bandages are great. If you guys, that's another awesome thing. We talk, they're in here. Didn't talk about it because it's not a part of this class, but an H bandage or an Israeli bandage is some of the best ways to add pressure to a wound, and move on to a secondary wound. Because so think of it as a capital H bandage, right? And the legs of the H are 3 feet long. Okay, so you're putting the pressure here, and then you're wrapping the legs of the H around the impact site. And the H bandage and the Israeli bandage are great resources. You definitely want to use it if you've got multiple injury sites. Let's put an H bandage on this one. We'll address this one. We move on to the next one. Okay.
Awesome.
Really good thing to have.
Yeah, great question, Charles. Let's talk about, yes, where do you get your first aid kits? Do you kind of assemble those on your own, or are there some places where you could just buy one of these and it has everything on it? For example, do they have them at Stop the Bleed?
So here's what my wife and I think are the best option for your first aid kit. And this is the folks that we built our first aid kit through. It's called Mountain Man Medical. Okay. Are they the cheapest? No. Do they have the best stuff? Yes, everybody's got the best stuff, right? Here's their guarantee. If you use one of their products that's in a pack that you bought from Mountain Man Medical, they'll replace it for free. Okay. I don't hold stock in Mountain Man Medical. I don't have a deal with them. I don't get anything if you put in a special code, nothing like that. I just love the fact that that's their standard policy. And that's who we built this pack with, in conjunction with them. This is a Mountain Man Medical pack that they built for our business. And so if you go on Mountain Man Medical and you buy one of their pre-made packs, and you have to use a tourniquet or a pressure dressing, you got to pack a wound, and you tell them, hey, I used my 2 tourniquets and my pressure dressing, then they'll say, no problem, send it to you for free.
Excellent. So last question we'll do is, are there any brand recommendations for sponge kits?
The only thing I would say is don't buy cheap. Go ahead and buy some extras. There's no brand recommendations per se, but also the big thing that's come out more recently is the compressed stuff. And I should have brought one here, but they will literally take a 4 foot by 4 foot sheet of gauze and compress it down to something that big and that wide, and it'll fit anywhere in your pack. You can't practice with it. Once you open it, it's open, right? But you can buy 3 and practice with 1 and put 2 in your pack. But look for compressed gauze. That's kind of a newer thing.
Got it. And it looks like Dave is kind of trying to play stump the instructor here. He's got a myth buster question. Can you hydrate a patient to the point that it thins their blood?
Technically, yes. But nothing that we would ever come across. You'll see, as an example, when it comes to someone that's lost blood volume, ideally you want to put more blood back into them. But what's the second best option? And you guys know the answer to this. It's saline solution. If you put an IV on a person, you're diluting their blood. Essentially, you're putting non-red blood cells into their body, and it's fewer red blood cells, but you're increasing their blood pressure, which is going to have their cardiopulmonary system work. So technically, yes, but we probably couldn't achieve that.
Right. Well, there is a comment here, and it says your wife is a rock star, Mike. And
No question. Something we can all agree upon. To the men out there, you all know we marry up, and to the
yeah,
women out there, if your man hasn't told you that he's married up, he's lying. We
yeah.
all marry up.
So I just want to give a huge kudos to you, Mike. Thank you so much for spending time with us. Thanks for educating us. I know you have a ton of things going on in your life. You're a busy guy, and to volunteer your time to do this, it's greatly appreciated.
For sure. Love passing it on to you guys, and you guys pass it on to students.
Yep. And just lastly, before we close the webinar, I just want to plug our Advanced Hunter Ed program. Go on to the website, California Department of Fish and Game, and just check out the Advanced Hunter Ed page. There's a bunch of clinics on there. There's all kinds of webinars that we're going to be doing. So stay tuned. And if you have ideas for a webinar, go ahead and give me a shout as well. If you have an idea for an in-person clinic as well, I'd be happy to listen to that, and let's make it happen. Let's keep the hunting tradition alive and well in California. With that, I'll sign off. And thanks again, Mike, for being with us. And thanks for all of you who took time out of your evening to spend time with us tonight. Talk to you later.